All right, so we just finished one of our differential diagnosis classes, and I just want to take some time to vlog, especially because this day was very special and memorable in a way, because our professor has shared a story about a particular patient. But before we get into that, I just wanted to emphasize the importance of differential diagnosis. This class was designed because as healthcare providers in physical therapy, sometimes we will be the first line of defense to screen out any possible red flags or 911s or medical emergencies. And we have to make the decision on either are you physical therapy appropriate or do we need to send you to the emergency room? And because we have this direct access, now we have this new responsibility. It's great because we get to see patients and we don't have to go through the physician or their primary care doctor or anything like that. But now we have a stronger or more, we have to put ourselves at a higher standard because they go through us. And if we don't screen them properly, it could be life or death. And so our professor shared a story about how this patient came in, kind of had some weird issues, had some leg pain, some back pain, some neck pain, some butt pain, pain everywhere, numbness and tingling down the legs. And we screened out that, okay, this might not be an orthopedic issue, it's not a neurological issue. So the class helps us differentiate between different types of the systems in the body, like the cardiovascular, the lungs, the GI, lymphatic, or even cancer, right? And so my professor shared that there was this patient and asked the class, and it was like a whole discussion in the whole class. Like, so what kind of questions would you ask? What would you look for? What's your objective exam? What things did you find? After you found that, do you feel like this patient is PT appropriate? Would you send them to the doctor? Would you refer out? Would you treat them? And so a lot of the time, the whole class was basically raising their hand and saying, all right, like, we're gonna treat this patient and move steps forward, but at the same time, we're gonna refer them back to their primary care physician. And so our professor said, well, what if they are not gonna be able to see their primary for a couple weeks? Would you send them to the emergency room or the urgent care? And the way that the patient presented, it was kind of like, it just didn't seem like it would be severe enough for a medical emergency. So we kind of all said, well, we would treat them, but we would also have them see their primary care physician in a couple weeks because, like, she has been having these symptoms for some time now. And just a little quick background on the patient. This patient had been having some pain in all the places that I described, and it's been getting much worse in the past 3 months. Complains of not really going to the restroom, being constipated, haven't really had successful poop sessions, feeling really fatigued, takes some medication, things like that. And it just didn't seem very red flaggy, if that makes sense. And so went out and we went through the discussion of what kind of diagnoses that we were possibly thinking of and all of that. And he shared that the patient actually did not go see their primary care physician, was treated that day and then was sent home. And then in the next 3 days, basically ended up passing away. And what happened was that there was a moving cancer, and cancers like these are not really detectable as much, and it's not really like clear-cut things about like, oh, pain at night or loss of appetite or losing severe weight very rapidly. Like she didn't really present with any of those kinds of things. And so lesson learned in this whole process is that, like I mentioned before, we can be the first line of defense And we should always ask, is this person PT appropriate? And if they are or are not, we have that responsibility to make that decision. What I try to strive for as a future physical therapist is that I will try my very best and I will do everything that I can to treat every patient like they are my own mother, my own father. If you're gonna be treating your mother or father, you're not gonna be thinking like, oh, you're just like this, all right, like you have this and that's it. Like, you're gonna be asking questions, you're gonna dive deeper, you're gonna figure out why, you're gonna figure out their psyche, where they're at in life, what's their mental well-being, their physical well-being, emotional well-being, all of that. And it just comes to show, and unfortunately, through this experience that my professor has shared, but through this time, it's a learning experience and a phenomenal reminder that we have such a high responsibility, and that as a future physical therapist, it just motivates me to just increase my standards, set my standards high, set the bar high, so that whoever comes sees me, I will always have a standard of practice that I will see this patient just like how I will see my mother or father or anyone whom I care very deeply for. So I just wanted to share that, and I hope if you're watching this video that you as well will put yourself at that high standard. And if you're a student right now, or if you're in PT school right now, or even if you're a PT watching this, or any kind of provider or person who does any kind of services just in life as an occupation, I really hope that the service that you provide will always be at the very highest, most elite standard you can possibly give, and that you will treat whoever or serve whoever to the utmost care. So, lesson learned, you guys.